Hello, everyone. Welcome to our webinar, Beyond Recidivism, a New Era of Measuring Reentry Success. My name is Nicole Jarrett. I'm a Senior Policy Advisor at the Council of State Government's Justice Center, and really looking forward to today's discussion. Next slide. The Council of State Government's Justice Center, we are a national, nonprofit, nonpartisan organization that combines the power of a membership association serving state officials in all three branches of government with policy and research expertise to develop strategies that increase public safety and strengthen communities. Next slide. The way we work, we help bring people together, we help drive the field forward with original research, we help build momentum for practice and policy change, and we provide expert assistance by tackling some of the toughest challenges that we see in the field. Next slide. And the challenge that we want to talk about today is how we measure reentry success. And so, the plan for our time together right now is that we'll go over how states are redefining reentry success, the critical elements to measure beyond recidivism, um, a national perspective of ways to better understand recidivism. We'll hear from one of our speakers about redefining success for correctional agencies and some of the approaches that are being taken in Ohio, as well as looking at non-traditional metrics to expand our perspective at looking at recidivism, looking at some of the work that's happening in Pennsylvania. Next slide. I am pleased to be joined by a distinguished set of panelist speakers. First, Dr. Ronald Day, Chief Operating Officer of the Fortune Society and also Justice Center board member. Brian Wittrop, Chief of Strategy and Policy at the Ohio Department of Rehabilitation and Corrections. And Dr. Lucis Malachek, Deputy Secretary of the Pennsylvania Department of Corrections. Thank you all for being with me. And I'm going to start off talking a little bit about what states are doing to tackle the issues around measuring reentry success. And we really see that states that have joined Reentry 2030 are leading the way. Reentry 2030 is a national initiative to dramatically improve reentry success for people leaving prison and who are on community supervision. And you know, one of the strategies to be able to address that, a key strategy to see this dramatic change, is that states are setting bold population-based goals and convening cross systems at a table to go about ways to identifying achieving those goals. Reentry 2030 states have defined what reentry success what it looks like for them beyond just reducing recidivism. The problem isn't that recidivism measurement is wrong. It's just that it's incomplete. It's like trying to understand someone's overall health by just checking their pulse. It's important, but absolutely, but it's not sufficient. And so for decades, we've been measuring reentry success through this single lens. Maybe there's four different ways that we constantly look at recidivism measure, but you're really looking at rearrest rates or reconviction or return from prison and maybe 1 year or 3 year rates. Um, but if someone avoids rearrest, but is still struggling, is homeless, has untreated addiction, we wouldn't necessarily identify that as true reentry success. And so we really want to take a deeper look at how we can get closer to measuring what success looks like. So I want to spend some time looking at a few examples of how states are defining how they're going to measure how their system is doing around measures of reentry. Next slide. So first we'll start off with Missouri. Missouri has had extraordinary partnership in developing a unified vision with the governor and cabinet heads, looking specifically at how to improve employment outcomes for people who are returning to community and people who are on supervision. And so here goes example of what they're looking at. They're looking at how well they're able to meet the needs through career services, looking at how many people are employed within 30 days post-release. Another goal is that 80% of formerly incarcerated individuals will maintain employment for at least 9 months after release. So looking at sustained employment. Next slide. Nebraska is looking at a variety of different measures. They have an executive a proclamation that they've used to identify their key goals, including promoting education, increasing 30% GED completion rate, 100% of people eligible who are eligible are actually enrolled in Medicaid, so these are the types of goals that people look at. Another measure that they've goal that they've set out for their system is assisting 100% of individuals who are incarcerated with obtaining state IDs and birth certificates prior to release. So these are just a small sample of the work that they're doing. Next, let's look at what North Carolina is focusing on. North Carolina has four goal areas: improving economic mobility, improving mental health and physical health, expanding health opportunities, and removing barriers to successful community reintegration. I strongly encourage you to check out their strategic plan, because underneath these four goals, they have a set of objectives. They have 28 objectives and performance metrics, so you get a really good example of what they're specifically trying to achieve by 2030. All of the Reentry 2030 states have high-level leadership and cross-agency partnerships to help support crafting the goals. And that's really important, because one of the things we hear quite a bit is like, well, where will we get the data to do this? And that's the reason why you need to have a cross-system approach. Just want to give a brief example looking at North Carolina. Next slide. Employment is a key reentry priority, I think, for all of the Reentry 2030 states. However, not many places are able to answer confidently how well people are doing on employment post-release. And so in North Carolina, the Department of Commerce is able to track the percentage of people who are employed 1 year post-release, as well as their median salary, as well as other data. So knowing, for example, that the median salary for someone who's formerly incarcerated is a little bit over $7,000, that has implications for reentry and interventions and things like that. So next slide. So earlier this year, the CSG Justice Center released a brief Beyond Recidivism, Redefining Measures to Understand Reentry Success. I strongly encourage you to check that out. In that, we identified 5 critical areas for measuring reentry success. The first one being recidivism progression. I know we said we're going beyond recidivism, but it's not just did someone recidivate or not, but looking at patterns over time, severity of new offenses, and time in between incidences. And I'll just give a few highlights. The brief will have a lot more examples. But for example, for a severity of defense, tailoring, it would help you tailor interventions and measures of desistance progression. So if someone moving away from criminal behavior, or are they increasing or escalating criminal behavior? So looking at felony versus misdemeanor, violent versus nonviolent, comparison of offense by degree and level, the percentage of individuals with a felony conviction who reoffend, but perhaps they reoffend with a misdemeanor. So looking at those patterns can tell you a lot about what the trends are for individual, and also on a population-based level, how well interventions are doing in terms of moving away from moving to a lesser severity of offenses. The other thing that you can look at is frequency of reoffense. So how many times someone has reoffended in the past year or 3 years. or have had a revocation or a violation. Looking at employment and financial stability. So, looking at job placement, retention, wages, career advancement. Most states have workforce training programs. So, knowing industry or job sector of post release employment would be really helpful for future programming. Knowing how many hours a week somebody is working, if it's part time or full time, all those are key indicators for understanding. Um, Employment stability. Next, housing security, sorry. A number of ways you can look at that, including the duration of housing, the average length of time someone has remained in stable housing, the rate of housing transition that's happened over a period of time, the percentage of individuals that have experienced housing disruption or evictions within a year post release, for example. So, all those are just different examples of duration of housing. You can look at housing type, whether in transitional housing or shelters or permanent housing, and for how long they were in each type of housing. What is the rent burden, the percentage of their income spent on housing? How long it's taking them to get to permanent housing will also have implications for reentry coordination and support and referrals. Next is health and well-being. Uh, Looking at substance abuse treatment, referrals, enrollment into treatment programs, completion rates. Looking at mental health status is another. Looking at um, guides for individualized, helps you guide individualized treatment. But specifically looking at the percentage of individuals who are diagnosed with a mental health disorder or condition using the same types of measures and metrics that people in the community use that will help determine whether or not someone has access to certain types of benefits or programs that would include things that looking at functional impairment, for example, post-release. So that is really key. Looking at Medicaid enrollment, which reveals you know, whether or not somebody has timely access to healthcare coverage, which is a very common indicator for access for people who are not in the criminal justice system. And so it will highlight policy and practice needs that need to be addressed, regarding enrollment delays, looking at healthcare utilization. That helps detect over-reliance on emergency services or underuse of preventive services. So looking at the average number of doctor visits, emergency room visits, hospitalizations, for example. And then last but not least, the social reintegration. And that refers to the process of people reconnecting with their families, social networks, and family and local communities. You could look at the frequency of engagement in faith-based institutions or community organizations. You can look at someone's pro-social network and their engagement, um, how well they're involved in different activities, and really the their perceived quality of their social network is a key measure. So that's just a sample of the types of measures and metrics that is in the brief, but what the field is currently looking at. And with that information and better data, we'll be in a better position to think about resource organization and comprehensive accountability and allocation. So with that, what I would like to do now is just turn it over to Dr. Ronald Day and to talk a little bit more about recidivism and ways we should be thinking about that more broadly and the work that the Fortune Society has been doing. Dr. Day?
Hello. Thank you, Dr. Jarrett. I appreciate it. Thanks to CSG for the opportunity to share some reflections and for the paper Beyond Recidivism. And thanks to the audience for joining us. I see we have nearly 700 people that have joined us for this conversation. So just a little bit about the Fortune Society. So Fortune is a community-based organization. We are based in New York City. We have offices in every borough save Staten Island. We've been around for 58 years. Last fiscal year, we served over 18,000 people. We provide comprehensive wraparound services. So from education to employment to housing to mental health, substance use services, creative arts programming, alternatives to incarceration. We're in the jails, we're in the prisons. We're an organization that is often thought of as a kind of one-stop shop. And so, in addition to services, we also do policy and advocacy because I often say that we can't service our way out of the conundrum that we find ourselves in with mass incarceration. So, we try to reduce the barriers, the stigma, the discrimination that the folks that we serve face on a regular basis. And in addition to policy and advocacy, we also do research. We started a research center a couple of years ago, and so we partner with academics, with think tanks, et cetera. Now, Fortune, we're not corrections, we're not parole, we're not probation, we're not academia, but we consider ourselves part of a coalition that is invested in increasing public safety through the services, through the advocacy and policy work that we do, as well as through the research. So, how did Fortune come to a point where we're discussing and are interested in thinking beyond recidivism? Well, one thing is that we look at the reports just like others do. We read these reports on recidivism and we see, in 3 years, 67% of all people that are released from prison end up recidivating. We look at other reports for longer periods of time, like more than 80% of people end up continue to be involved in the criminal legal system. And we're saying that is there a much more complex and nuanced story to be told. And we certainly think that there is. And so we were also getting requests from funders, and funders ask you as a community-based organization, like, what's your recidivism rate? How are you helping to reduce recidivism? And we realized that there's a fundamental lack of understanding about recidivism, the drivers of recidivism, the limits of recidivism, and our organization's power, right, or limited power in influencing recidivism. So one of the things that we did is we decided to embark on a study called Pathways Home: Desistance in the Context of Parole, because we wanted to think not just about what the failures are, what recidivism is, the rearrest, the reconvictions, the reincarcerations. We said we know that there are people who are transitioning from prison to the community and are doing relatively well. And so we embarked on this study in 2022. We're actually finalizing our analysis now, so we should have information available to everyone in about another 4 to 5 months from the report. So we partnered with the New York State Department of Corrections and Community Supervision, and we work with people who are on parole, who just came home, released from New York State Corrections, and are on parole in New York City. And so we recruited 406 individuals, and we followed them in a longitudinal study for 2 years. And we learned a lot. We lost a lot of individuals during the study. We lost over a dozen of our participants. Some end up succumbing to like overdoses and other and died in other ways. And many were rearrested. We went back to meet them on Rikers Island and did interviews with them there, and we lost contact with about 50, more than 50% of the folks that we were working with. But many of the individuals remain home and they are doing well, and they did well over this 2 year period. So we're trying to provide some context. Is there some secret sauce? We don't necessarily know, but we do want to understand more about what were the drivers of those individuals, right? And the factors and influences that supported their transition from prison to the community. There are very few studies, especially longitudinal studies, that have done this. So we are very excited to put a report out, like I said, in maybe like another 5 to 6 months or so, and share what we've learned in this particular study. One of the other things that happened with us over the years is that there's a report called The Limits of Recidivism: Measuring Success After Prison. And you'll see from the report that Dr. Jarrett discussed that this report was cited twice. So I was selected as a member of the committee that put out this particular report and was very excited as a formerly incarcerated person who served 15 to 45 years in New York State prison, who went to prison with only a GED, and now, I don't know, 15 years in prison and 18 years home now, and I have two master's degrees and a PhD. I'm able to be a part of this particular panel and help kind of shape the ideas, opinions, and reflections that went into this particular report. One of the things that I want to mention is I'm gonna mention a couple of metrics that we discussed in addition to the ones that Ms. Jarrett just mentioned a second ago. But the first one that came out of this conversation was that the voices of formerly incarcerated people often omitted from research, and that formerly incarcerated people often have the most insight about what actually works and what doesn't work, and that engaging with this community actually helps to build trust. Where distrust has often been pretty pervasive, we heard that in these you know groups that we organize, these listening sessions to find out what were formerly incarcerated individuals, and these individuals were actually, fairly successful themselves. Some had been home a couple of years, some had been home 10, 20 years or so. But we made sure that that was a core part of the project. So just quickly, some of the alternative indicators of success that we discussed, besides the ones that Dr. Jarrett mentioned already, was one was well-being. And we went with well-being because we really wrestled with the idea of success. Even though the report is limits of recidivism measuring success, we were like, success is defined differently by so many people. And so there are instruments to measure well-being. And if you look at the report, you'll actually get, an idea of some of those instruments. But we wanted to get a much more comprehensive understanding of how people are doing in their transition from prison to the community. And one easy example for us is if a person is not getting rearrested or is not getting a violation of their parole or their supervision, does it actually mean that the person is doing well? Now, obviously, that's not the case. Quite the contrary, in some instances, the person could be struggling mightily to survive. And the reverse is also true. A person who's rearrested or who gets a technical parole violation could have been doing very well and will likely have a major setback because of a recent engagement with the criminal legal system. So another thing that we discussed besides well-being is also overall health. Now, Nicole mentioned that a little bit. I'm just elaborating on it slightly. Oftentimes, the research focuses on a particular issue, HIV, diabetes, hypertension, or something else. These are all very important, especially for people that are coming home from incarceration. But we were looking and talking and thinking about overall health. And we're trying to figure out some alternative measures for success. Don't just focus on one or two domains. And that's why we really pride ourselves at the Fortune Society at being an organization that offers so many comprehensive services, because some organizations can only offer one or maybe two or sometimes three services, but we see that the continuity of services is really important, and that if a person is getting employment services or getting some connection to health care, they also might need connection to benefits. How do I get benefits access? And some others, how do I get treatment services or what have you? And so the fact that we can refer people to all these different services, we see that as being hugely important for what we're doing, especially engagement. Another one of the issues that we discuss is engagement in healthcare. Like, how do we ensure as people transition from prison to the community or just engagement with the system, that they are connected to especially to a provider, because we know from many studies that individuals end up in emergency rooms when they don't have that type of access to care. And one thing that I know from incarceration, we know from all these studies, is that people who go in at times to prison, they do not want to engage in healthcare on the inside, partly because there's, again, a lack of trust. And they think that instead of getting care, that they might actually get harmed. Another thing that wasn't that we didn't touch on yet is education. And I mentioned again going to prison with the GED. We know that individuals, New York State, and other states in the federal system are being released from incarceration, sometimes after long stints, without having acquired a GED or high school diploma. So when they come to us and they're trying to get employment related services, we're talking to them about what are their long-term trajectories going to look like if that basic credential hasn't been attained. And so we're trying to encourage people to get as much education as they possibly can. If it's not academic, then maybe some industry recognized credentials, because we know all too well that if people don't have basic credentials, that they're really going to struggle for the long term. Nicole talked about social relationships. That's also very important. And a lot of times when we re with recidivism studies, it's kind of you're not thinking about all the nuance that's happening with people. You think, for example, women. So many women are now impacted by the system. When you ask women what is it that they are most interested in when they are returning home from incarceration, if they're parents, it's reestablishing contact with their children. Now, when you talk to dads, that's not necessarily the case. Not that they don't want to reconnect, but that's not going to be the highest priority for them, at least that we know that they're mentioning. Another thing is civic engagement. Are people civically engaged? What impact is being civically engaged having with people, especially those who, like myself, had been totally disconnected from civic life. So these and some of the issues that Dr. Jarrett already mentioned are highly important. I want to touch on employment as well. I know she did a second ago. Intuitively, we believe that a job can change someone's life. We offer comprehensive employment related services. I've supervised our employment services programs for years. We see it happen routinely in our programs that people can do extremely well when they get jobs. But what about the long term? What about the success over time? Research is pretty sketchy, pretty shaky on the benefits of employment programs. I feel torn saying that, but it's true. And that's because there are so many thorny issues related to employment outcomes, wages, benefits, company politics, all these different issues. I ended up doing extensive research on this particular issue for my dissertation. And so I just became like enamored with learning as much as I possibly could about all of the different factors that coincide with people who have been involved in the system being gainfully employed after a touch point with the criminal legal system. So if you're interested in more information about that, my dissertation, I could obviously point you to that. But I'm going to pause there because I know we got a couple of other presentations and happy to answer any questions at the end of the session. So thank you so much for the opportunity to speak about this issue.
Oh, thank you so much. You really raised a number of really good points. We'll turn over. We'll have hopefully some room for time for questions at the end. I love the examples that people are putting up in the chat. If you have additional examples, please put that forth. And I'm going to ask Brian Wittrup to go ahead and share a little bit about the work that he's been doing in Ohio.
Thank you very much. Hello, everybody. Well, we've already got a couple of welcomes, so I won't go through any of that rigmarole. I am from the state of Ohio, work in the Department of Corrections. This has been one of our big tasks, and to really look at metrics for success in corrections. And that, of course, leads us back to recidivism. However, there's a little bit of a different thing is that our work on this was prompted by the Correctional Leaders Association. There was a committee that was chaired by our director, Annette Chambers Smith, that was all about bringing us all together as different jurisdictions so that we're using the same, definitions and all these kind of things. Well, we studied that. All right. And bottom line, it's not possible. You can never compare recidivism across jurisdictions. It's never going to happen. There are too many circumstances that are going on. And so we don't know, let's say if someone, hey, we have this best practice over here that reduces recidivism by 17%, but their definition is 1 year, or their definition, or on the other hand, somebody only has a program that reduces recidivism by 4%, but their recidivism metric is more robust. It's include arrests or even reported behaviors and things of that nature. There's just too many definitions. And let's be honest with each other as practitioners. Our budgets come from government and from elected leaders and things of that nature. And people are not going to change their definitions that they're using because they've been using it for 20 years. Ours has been around for 25 years. So as long as you're always an apple, comparing apples together in Ohio works. But if we try to compare our apples to the oranges of Indiana or to our partners over there in Pennsylvania and so on and so forth, that's a struggle. And it's not just the definitions, it's broad social trends. For example, the most powerful social force that affected recidivism, COVID. That was a shutdown of the criminal justice system. Sure as heck is going to have a major impact. And if as corrections professionals we are judging ourselves, our success based on that, well, we're kind of taking a victory lap for something that we had nothing to do with. Furthermore, on the other hand, there can be public policy, there can be broad other social trends that actually increase your recidivism rate. For example, if all of a sudden there's a massive crackdown across multiple jurisdictions, or laws get changed, or sentencing practices get changed, or social services are interrupted in the wonderful work that the Dr. Day is doing, over there is interrupted because of funding or something like that, and all of a sudden recidivism goes up, and we look back and we say, hey, but that really wasn't us. It's too complex. And one of the biggest things about it as well, and I'm sorry, but it can be manipulated. It can be manipulated. I always say that somebody could appoint me to be a director of a major correctional agency, and I will be the most successful director in the world at reducing recidivism because I am going to stop all parole violations whatsoever. No one's ever coming back to prison in my state. Presto, I've just dropped my recidivism rate by 13%. Well, that's counter to our missions, and that is, protect the community and improve lives and so many other things that when you define your success as an agency in a manner where you don't control the metric, it can be demoralizing. It can be, it can cause misinterpretations. And also, a plain truth is it lacks facial validity to non-practitioners, even to some practitioners. Like, for example, if you go talk to corrections officers, or you talk to case managers, or you talk to different people, and they all bring up different things, about recidivism or what have you, that doesn't even have facial validity a lot of times with them, because people will define it differently and they'll look at it differently. And so with all of these major problems, you have this rehabilitative efforts can be hindered by even informal practices. So let's say, for example, I'm sure many of you have heard as practitioners, we can't get anybody to get jobs. We don't have anybody working right now. It's a major complaint. Everybody's bringing it up. And then as a person who is interested, and during a reentry process, you send over 100 people for a job, but then there's an informal practice at that location that says we don't hire anybody that has any type of record. Well, at that point, you're completely hindered by something informal and beyond your control. Recidivism is a societal metric of how good we are as a society at dealing with a multitude of issues. Because with corrections, we're the end of the line. The people that come into our doors have already passed through every major social institution that exists. We're talking about going all the way back to, prenatal care. We know all this information, we know all these facts, and we know that by the time people get to corrections, they have profound needs, and there are profound social forces that are leading them, that are contributing to the criminality. And we can't fix that. And since it's a societal metric, that's not what we should be judging our operations inside of correctional agencies based upon. That's the perspective that we have. One of the things that basically happened was, while we were in the process of looking at this, we came across the social determinants of health, which I think most of you would kind of be aware of, and will be spoken about in different ways, has already been by both presenters already, different ways. But if you look at, this is a CDC, the social determinants of health, if you look at those, they are almost 100% correlated with what we know also stops criminal behavior. We know that strong communities, economic, jobs, stability, mental health, medical care, these are all things. So the way a society scores on the social determinants of health is how we're going to do when it comes to crime and recidivism. And so for correctional agencies, what we basically in Ohio feel that we should go towards is, let's work on those aspects of the social determinants of health that we can have some influence, with respect for a couple of very important pieces. What can we do realistically as an agency when rehab and reentry we're big time on that, but we got to be honest, we spend a lot of money on staffing, security, facilities. I mean, that's where our and we're a big ticket item. We're huge on a budget. And so there's a lot of good ideas people have out there they want to do besides funding prisons. So we have to really focus on what we do. And here's the thing, we know what works. The recidivism metrics and all these things, this has been studied repeatedly. We know what will help. And we also know what we can measure reasonably, because that's the other thing too. We don't have the resources to go out necessarily and gather massive amounts of data. We have to look at already available data sources. And then finally, one of the big motivations, before I get into a few examples of our direction that we're heading into, and this is a lot of information in a short period of time, trust me, it's we could talk for hours about it. But one of a big piece of this as well is public policy and advising public policy. Recidivism metrics usually are like a 3-year. Most of the states were doing that. So what you have is a situation where if I or our agency were to establish a new policy, a new way of doing things, we're going to need 1 year to ramp it up. We're going to need a year of exposure. We're going to need to follow a class of people for 3 years afterwards. Then we've got to put all of that. It's 6 years later. There is no politician that wants to hear, I'll get back to you in 6 years and tell you if the $10 million you gave me is doing any good. You got to be a little bit more nimble and quicker in this modern age in which people are data popping everywhere. So that's what we really kind of focused on. And we looked at such things as education. We know education works. Education not only works by reducing recidivism, it reduces crime, it increases your chances of being employed. It just works. We know it. So we don't need to study that anymore. What we need to do is we need to find out how well we're doing at getting people educated. So how many people come in that need a GED, get a GED? How many people do we serve? Are we doing our best to maximize the resources that we have in those areas? Or college education, job and vocational training. But here's the cool thing we can also do in Ohio is we can train somebody, we can do our vocational programs, then we follow them after release, and we can get tax records and we can know identified whether or not individuals who go through particular programs are going to how their wages, well, how fast did they get employed, how all these different things that we can say, and we can get that in like 6 to 9 months, maybe a year at the max, to know what vocational programs are paying off the best. Also, we've already talked about whether or not people have a residence, but the Medicaid pre-enrollment, that was brought up as well. We know that if you pre-enroll people in Medicaid, that you not only reduce all of the metrics that we look at for criminal, recidivism, just all of them, but also the most amazing thing about it, in my opinion, is that it literally reverses the systemic disparities that exist for African Americans in the United States. It's a program that benefits that group more. And in a world in which a lot of times our institutions amplify disparities, when you can reduce those as an agency, that is a huge thing. And we know now right away, we can tell people factually this works. So what is our metric? How effective are we at getting them pre-registered? And if that slips down, we know we got to improve our performance. But we're doing our part to help and to do what we can do as a correctional agency based upon the limitations. And I now have hit my time. So back at you.
Thanks, Brian. Really appreciate your insights there. Let me turn it over to Dr. Luca Malashek to talk about the way you guys are approaching this challenge in Pennsylvania.
Thank you, Dr. Jarrett, and much appreciated the invitation here to speak with Brian and Dr. Day. This is a wonderful opportunity, and so glad to share what we're doing here in Pennsylvania. When we talk about reentry success today, especially, you can hear that the conversation is shifting in important ways, and we're beginning to recognize that success is about more than just whether someone comes back into prison. It's about the progress that they make along the way. And so whether it's obtaining the GED or securing a job or finding employment or even something as basic as getting an ID, these are critical milestones and they should be celebrated. And they let us know that people are taking meaningful and positive steps forward in their lives. And in many instances, as correctional professionals, we are contributing to those positive steps in their life. But even as we embrace these new holistic measures of success, I think it's important, and I'll step out on a limb here, kind of on my own, I guess. I think it's important that we don't lose sight about recidivism. It remains a vital and central measure of reentry success. And I think it does because it gets at the heart of what corrections is supposed to be about. And, in Pennsylvania, and I imagine like many other jurisdictions, a part of our mission statement is an effort to help reduce recidivism. And our mission statement also mentions ensuring that we provide educational opportunities and ensuring that medical and mental health care are being delivered. But if you think about our work through the lens of a business, and you ask yourself, what do we build here in corrections? And I challenge you to think about a business like Tesla. Tesla builds cars. Apple builds phones. So what do we build here in corrections? And to me and to us in Pennsylvania, it's public safety. And so what we're talking about here today through the lens of business is now, how do we measure our success in building public safety? And I think if we exclude recidivism from that conversation, we don't necessarily have the entire picture. Just as everybody else has been saying, if we simply look at recidivism as the only measure of success, I think we're missing the mark as well. I think recidivism is not necessarily an individual metric. I think this falls along the lines of what we've heard today from others. Recidivism is, I think, indicative of a systemic measure of success, and not just a corrections measure of success. For us, it's the Pennsylvania community and all of the interconnected web of resources that are in place or are not in place to support our folks when they are coming out of our correctional system. I think if somebody earns a GED, that's fantastic. Somebody secures employment, that's a huge barrier that is being addressed. They secure a place to live. It's going to change their lives. But if that person then also recidivates, we are not meeting what our goal of what we have set out to achieve. And again, the opposite is true as well. I think a colleague of mine, Dr. Brett Buckland, who's the director of the Bureau of Planning, Research, and Statistics for the Department of Corrections, he and I have had conversations about this issue, and he believes, and I do too, that recidivism provides somewhat of a common language. Not always, as Brian has mentioned, but to certain folks, it is. It's familiar. It's familiar to policymakers, certainly different in jurisdictions for sure, but to lawmakers and frankly to the community and to victims, they know what that is. It's somebody who is previously engaged in crime who is now engaging in crime again. I think recidivism, it forces us to be honest about barriers that people face. And if recidivism rates remain high, we recognize that likely those social determinants of health that are referenced earlier, they still are concerning and they haven't been addressed completely. So yes, I am with the group. We absolutely need to broaden how we view reentry success and how we measure reentry success. We need to count GEDs. We need to count IDs. We need to measure how long people are employed or how long it takes for people to get employed. We need to measure how quickly we are getting people enrolled into Medicaid. But we also need to keep tabs on how often these folks are committing additional crimes and getting recommitted to prisons as well. In Pennsylvania, we continue to lean into measuring recidivism and defining it with rearrests and reincarceration. But we're evolving how we use the metric of recidivism to define our success. And historically, we've done what most jurisdictions have done. We measure recidivism and we report it. And we report it publicly until now. So in January of 2025 of this year, we began a new statewide project called the Recidivism and Desistance Initiative, or RDI. The novelty of RDI is that instead of simply reporting our data publicly by state prison, and noting the changes year to year between people who come through our state prisons, what RDI now does is we are collecting data and we are reporting our recidivism rates, not only for our state correctional institutions, but we are also doing it for our community correction centers and our community contract facilities and all of our parole district offices, accounting for all aspects of our organization, both inside and out, including more than 60 locations. This is a huge undertaking for us, but that's not all that we've done. So instead of just collecting and reporting the data now for all of our locations and not just our state prisons, the Office of Reentry has partnered with the Bureau of Planning, Research, and Statistics, headed up by Dr. Brett Buckland, and we have established objective recidivism reduction and desistance enhancing goals for each and every one of our locations. And all of these goals are objectively different for each location. So for our state prisons, we looked at recidivism data for the years of 2022, and 2023. We excluded the COVID years, and we created monthly expected average recidivism rates. These were our goals for each month in the year of 2025, and we will continue to do this moving forward. Then, beginning in January of this year, we began tracking every single person that left our system, and we monitored their rate of return, either through rearrest or reincarceration, against these expected monthly goals. Now, because transfers happen, and each prison has unique factors and a unique mission, and now unique objective recidivism reduction goals, the elegance of this approach is that each prison is only compared to themselves. And again, there are certainly criticisms of this approach, I imagine. But given that transfers happen, and we are also weighing the amount of time that a person has spent at each prison during their incarceration, and we are allocating that proportion of time to the responsibility of recidivism or the success that that person has experienced to each prison. For our community correction centers, we've established monthly expected average recidivism rates based off of monthly recidivism data from last year. So now, on a monthly basis, all successful discharges that come in through our centers and are successfully discharged out of our community correction centers, we review them over a rolling 6-month period. The percentage of those discharges that are arrested or went back to prison for any reason, including technical violations, are calculated. Again, as the same with our prisons, because of the approach that we're taking, each center is only compared to themselves. We're not comparing one center in Philadelphia to another center in Pittsburgh. It is really a race against yourself. And for our district offices, we are using recidivism data from 4 of the last 6 years, like we did with our state prisons, to generate these expected average recidivism rate goals. We then look back over a period of 1 month, and we are including a large sample of those on supervision and calculating those who were rearrested while under supervision. We're including only rearrests because we are concerned, as mentioned earlier, we're concerned about the data potentially being unintentionally or intentionally manipulated by our staff, and we don't want that to be a part of this analysis. But picture this. On a monthly basis, we're collecting all of this data. We're reporting out on all of this data as close to real time as we possibly can. We're actually comparing each location to established goals that they are aware of. And this data is shared statewide on a monthly basis within our core report. That's CORE, our Central Office Reentry Report. This data is not only shared, but we have established incentives and rewards for those locations who are meeting their recidivism reduction goals. An example of the monthly incentives that we established, we are providing, and this might sound different, but it's something that we thought would be valued by our institutions and our locations, but we are sending them official certificates signed by the Secretary of Corrections and other relevant executive leadership staff. And once received, our prisons, our community correction centers, and our district offices are using these accomplishments as opportunities to empower our staff, and they're taking photographs of their expanded teams, and those photographs are being shared internally and recognizing sites that are experiencing success. For those sites who have achieved 3 or more consecutive months meeting their recidivism reduction goals, not only are they receiving this framed certificate and they're taking these team photographs, these photographs and their stories are being shared publicly on social media and other public media platforms to celebrate these wins, our teams, and to allow these folks to tell their story about their success of those reentering the Pennsylvania community through their locations. In addition to this piece of RDI that we're talking about, we've also begun hosting brainstorming sessions. And again, I agree, research is quite clear on what does work, but I don't think we're done. And these brainstorming sessions have been focused on identifying the potential local or organizational influences or factors that are contributing to the positive or not positive outcomes that locations are experiencing with regard to reducing recidivism. And I wanted to share a few of these outcomes with you that we've heard from some of our sites. One of the community correction centers, they noted that over the past year, so January to July of this year, they've recognized and objectively recognized that there has been a rise in their hard-to-place population, making it more difficult for these folks to be successfully reintegrated into the community. We've also recognized an increase, and this was mentioned by another community correction center, an increase in the number of reentrants who are coming to a center who were not originally from that area. Although there's research that actually suggests that they should be actually experiencing better rates, our folks are seeing that that might be part of the reason why they are experiencing the success. Some of the hypothesized reasons for success at multiple sites have been cited. We've cited employment rates, has been talked about earlier today. We've also talked about a new budgeting program that was implemented at the beginning of the year at one of our local facilities, and we are experiencing positive outcomes because of that as well, we believe. I wanted to share with you an email that we received in response to one of our brainstorming sessions from the center director in the Community Correction Center within our Bureau of Community Corrections. A snippet here of what the staff's experience with our new RDI initiative has been in our brainstorming session. They said, today's meeting was enriching and enlightening, giving us more momentum to stay the course. While realizing we are experiencing a positive reduction in our centers with regard to the recidivism rates, I fully believe our work is just beginning. She forecasts that our recidivism rates will continue to drop under our team's leadership with the dynamic staff at our Community Corrections Center. Not one single staff is responsible, but all of us as a team are responsible. Our security lieutenant even mentioned how communication has shifted at the center over the past year. We're now working as a cohesive team on a mission to achieve the same goal, not to have our reentrants return. So she also mentioned collectively, we meet with all reentrants with a humanistic approach, offering support, guidance, and modeling behaviors that I believe the reentrants in turn model outside the center. The email goes on and on and on to demonstrate that there is buy-in to this and that they are truly working together as a team, which is completely different than what was happening with that center a year ago. I think this is just the beginning for Pennsylvania. We will continue to work together to study ourselves, to celebrate our wins, as we've mentioned today, learn from our mistakes, and hopefully work together to reduce recidivism together. Appreciate the time to share these thoughts with you today.
Great, fantastic. Really appreciate that. We have a lot of questions, a lot of activity in the chat, which I truly appreciate you all weighing in. One of the questions talked about validation of the measures, and I just wanted to address that quickly because sometimes we think about these reentry metrics as just factors related to recidivism. And yes, they are, but they are by right outcome measures for different parts of the system. So one of the shifts that we're hoping to see, and one of the shifts I think Reentry 2030 states are making is that it's not all on corrections, right? There are things that can be done to help prepare people and make sure people have IDs and take advantage of pre-release programming, but proper ER use, that is something that the health system should be thinking about. Understanding this population may have a higher propensity to misuse at higher rates emergency rooms, or maybe have a lower self-assessed health status, which is, I'm glad that was mentioned, that's a very powerful measure of health. You just say, I'm in good health or bad health on a scale of 1 to 5. Those are really powerful metrics. So other systems, if you talk to people in the housing field, they will talk to you about housing type and eruptions and percentage of rent versus income. Like they will tell you about those metrics. The same when you talk to people in the public health field, they'll talk to you about access to insurance, and they'll talk to you about mental health. They'll talk to you about physical well-being, having a primary, all of those are standard measures. And so what we're, same thing, education and income. So what we're talking about in this is other parts of the system, understanding where the reentry population is in terms of their general metrics, so they're not like lost in the sauce, that you may say, oh, this is just one group of people in this zip code, but it may not just be the zip code. It may be it's the people who are returning to a particular zip code that are making their outcome measures kind of, showing people at higher risk. And so, and then, like in Arizona, Reentry 2030 states, each agency then looks at reporting out how well they're doing. And so, I'm glad Brian mentioned the social determinants of health. We are now moving we talk a lot about individual criminogenic risk needs and getting people the right programming. And then we're talking about peers. We also have to talk about facilities and institutions and policies and practices. And we're talking about community. That is a parallel that we're talking about. We are at time. I thank you so much to outstanding panelist speakers. We definitely could have gone much longer. Really appreciate it. Thank you all for tuning in. If you are interested in this topic, please stay in touch. Reach out to us at the CSG Justice Center if you're interested in Reentry 2030 or you want to have an individual conversation, your jurisdiction's interested in looking at additional ways of measuring reentry. Happy to have that conversation. Take care, everyone. Bye. Oh, and a recording will be available.